Hi everyone. Today my topic is hepatitis. Hepatitis. I know this is a broad topic. It's got so much to talk upon. Um, so I'm not going to go over each and every detail. Let's cut it short, and I'm only going to discuss about CCS, the points that will fetch you more score and help you pass the CCS, which is what I am focused on. Okay, so the main case that the CCS looks at, one of the case is hepatitis A, apparently. So, what do you know about hepatitis A? This is subclinical. Incubation period is longer. It will subside on itself. Okay. And then it will present with abdominal pain, nausea, vomiting, diarrhea, and so on. More likely travel history, ship, cruise. Um, Lab investigations will show AST, ALT rise. Patient will have fever, and there can be something like aspiration pneumonia here and there. So this is entirely different concept. But then there are patients who can develop aspiration due to excess of vomitings. Okay. So you did the LFTs and ASD-ALT came in thousands, meaning greatly elevated, spiking to thousands, 2000s. What could be the causes? This is like very important. First important cause, drug induced liver disease. Next important cause, copper, Wilson disease. Finally, iron overload, meaning hemochromatosis. These are three causes where their AST-ALT will be very, very high. Lot of you might come across patient with fever having hepatitis A. Again, there are pitfalls, and I'm going to discuss the pitfalls because I really, really focus on the pitfalls. We tend to give acetaminophen, yes? So what happens when we do acetaminophen in a hepatitis patient? We are causing further damage. So always important to avoid this. I like to discuss what to avoid because this way we can remember what to order in return. So what are the orders? The relevant and most important is acetaminophen, toxicity, normogram. This is order that is going to come up when you type everything, or let's say toxicity. You should be able to pull out big list. So when it is above threshold, we do want to give. Any guesses? Of course, we want to give N-acetylcysteine. This is very important to prevent further damage. Okay. In the preventive care, you may want to educate the family members, have them vaccinated because they are exposed to the hepatitis A. There can be, this is what we call as the post-exposure prophylaxis. Now, you may ask me if we have to do investigations like copper, iron, and so on. I would say yes, you should do it because it does come under thousands. You do have to include copper and iron on your orders to identify the root cause. Okay. Coming to our topic of aspiration pneumonias. This can be treated like any other community acquired pneumonias. Just like how you do chest x-ray and all that. Don't forget one big thing, that is sputum cultures, blood cultures. For any infectious case, we always want to do sputum gram stain, sputum cultures, blood cultures to narrow down the antibiotics. The most common antibiotics that you might want to remember is moxifloxacin. I really like this one. Moxie is better to include. And then we can include amoxicillin, sulbactam. If a patient is allergic to sulbactam, you can do ceftriaxone or our famous meropenem, imipenem, piperacillin, tazobactam against pseudomonas. As simple as that. Do not have to include coverage to anaerobic agents because usually the patient would present with foul smell. Classically, they would describe putrid smell. In that case, you can go ahead and do anaerobic coverage. As per the guidelines, it is said that this coverage would be sufficient. You don't need to do anaerobic coverage unless and until it is something like lung abscess. There can be complications, right? So, lung abscess in that case, or there can be something like empyema. In that case, you have to do that. Okay, that is it. This brings us to the end of the session for today. I hope you really like it. And do let me know if you have any other doubts. Happy to help. Thank you for watching.